Welcome to Radiology Made Easy. Today, I'm examining a frontal chest radiograph of a skeletally mature patient. On this image, I can see that the heart appears enlarged. There's also some airspace opacification in the right mid-zone, which I suspect is most likely infectious in nature. The lungs otherwise appear normal. However, I'm noticing some subtle underlying skeletal abnormalities. Specifically, a number of the anterior rib ends appear widened, and the humeral heads may be slightly dense with some flattening of the contour of the left humerus. These findings are subtle and might be unrelated, but they catch my eye as potentially significant. It would be valuable to review any relevant previous imaging and the overall clinical picture, as these could provide further context. In this case, the combination of skeletal abnormalities, airspace opacification, and cardiomegaly suggests an infective exacerbation of sickle cell disease. This constellation of findings makes me consider this diagnosis more likely, especially given the common skeletal changes associated with sickle cell disease, such as marrow hyperplasia and avascular necrosis, commonly seen in the shoulders and confirmed on MRI in this patient. When thinking about sickle cell disease, it's crucial to remember that diagnosing it from a single film can be challenging. However, the goal is to illustrate how we can pull together and present a tricky case with multiple findings suggesting a particular diagnosis. It's not just about the acute infection, it's about recognizing the broader pattern of abnormalities. In practice, the frequency with which I encounter sickle cell disease, or other conditions like Paget's disease, asbestos-related disease, or HIV, depends on the local population and the medical unit's focus. For example, in Viva exams, I make sure to familiarize myself with classic radiological cases that I don't see regularly. It's also helpful to consult with senior colleagues and review films from other centers. When reviewing images for potential sickle cell disease, I look for a range of skeletal features, particularly those resulting from either marrow hyperplasia or vascular occlusion. This includes widened marrow cavities, reduced bone density, expanded or thinned cortex, and coarsened trabeculae. Also, I'm on the lookout for vascular occlusions, such as bone infarcts or avascular necrosis, and specific bone shapes like H-shaped vertebrae. Additionally, I'm aware of the possibility of disturbed bone growth and osteomyelitis. Extraskeletal features are also significant. For instance, extramedullary hematopoiesis can present as a paraspinal mass or occur in other areas like the liver, spleen, or skin. The spleen's condition can be telling. It's usually enlarged in early childhood, but may become small and calcified later on, known as autosplenectomy. I also consider the presence of gallstones, signs of a current crisis, or symptoms due to vascular occlusion, such as cerebrovascular accidents, renal damage, or pulmonary embolism. Sickle cell disease is an autosomal recessive hemoglobinopathy. Patients with this condition develop symptoms due to abnormally shaped erythrocytes, which increase blood viscosity and lead to occlusion of small blood vessels, causing organ and skeletal damage. There is a significant risk of infection, which is the most common cause of death due to the loss of splenic function. Thank you for tuning in to Radiology Made Easy. Remember, every image tells a story, and I'm here to help you decode it. Please share your thoughts and suggestions in the comments below, and stay tuned for more insightful discussions. See you next time.